Hello everyone, so today we will talk about the innominate dysfunction. The innominate dysfunction is a very common cause of back pain and pelvic pain. This also explains to you why one of your legs be longer than the other one. Alright, let's talk about the anatomy first. So here's a pelvic bone. So we have the ASIS on the front, on the back we have the PSIS. The ASIS and the PSIS are very important for diagnosis purposes. Right here we have the ilium, the ischium, and the pubic bone. Okay, but we've mainly focused on the ASIS and the PSIS for today. There are 6 types of innominate dysfunction. I'll show you using my hand motion to make it easier. So this is my ASIS and my thumbs are the PSIS. Right here the pubis synthesis, and my pinkies are the leg length. So let's say that I'm done with the diagnosis and the positive side is the right side right here. If the patient have lower ASIS and higher PSIS, look like this. So when you check on the leg length on the patient, you will see that the leg length now is longer on the positive side. This function is called anterior innominate. The opposite is the posterior innominate. This is when the patient has higher ASIS and lower PSIS. So when you test the leg length on this patient, you will see that the leg length is now shorter on the positive side. The next dysfunction is called outflare innominate. This is when the ASIS is further away from the midline. Look like this. Alright, and when you look at the foot on the positive side, you will also see that the foot is also turning outward like this. And the next dysfunction is the inflare innominate. This is opposite to the outflare one we talk about. This is when the ASIS is more medial to the midline, and it's look like this. When you see the pelvic down below, it's look like that, turning inward. And when you look at the foot on the positive side, you will see that the foot is also turning inward. The fifth dysfunction is called superior innominate shear. This is when you have a superior and ASIS and superior PSIS at the same time. Just look like this. And the last one we have inferior innominate shear. Is when you have inferior ASIS and inferior PSIS, and here's how it looks. Those are the basic dysfunction that you can have with the innominate. There are a couple of ways that we use to treat innominate dysfunction in osteopathic manipulative medicines. The most common treatments are MET, which is muscle energy technique, high velocity and low amplitude adjustment manipulation, and the last one, physical therapy. Type of treatment will depend on the patient diagnosis, also if the patient has any complication.